Hello and welcome back to the channel. We are discussing UTIs or urinary tract infections today. From understanding what are UTIs to what are some of the crucial roles of the urinary tract, who are more likely to be affected by the UTIs, signs and symptoms, prevention and treatment options. So whether you are looking to avoid a UTI, seeking relief from one, or basically just looking for information about UTIs, this could be the video for you. So a UTI or a urinary tract infection is an infection in the organs in your urinary tract, which involves the kidneys, the ureters, the urethra, and the bladder. The urinary tract is made up of the upper urinary tract and the lower urinary tract. The upper urinary tract involves the kidneys and the ureters, and the lower urinary tract involves the bladder and the urethra. Most of the infections involve the lower urinary tract and are caused by bacteria known as the E. coli. So although some research has been shown that some are caused by fungi or viruses, it's very, very rare. So what you have to know is the UTIs are one of the most common infections in humans, and they're caused by bacteria known as the E. coli that lives in the digestive system, normally in the bowel, and it usually involves the bladder. So the bladder is the one that is normally affected by the UTI. So how does the urinary tract play a crucial role in the body's waste management and fluid balance? Number one is storage. So the bladder normally stores the urine until it's ready to be expelled from the body. Then number two is excretion. Urine is normally expelled from the body through the urethra during urination. Then number three is filtration. So the kidneys help to filter the blood, removing waste products and any excess substances forming the urine. And then number four is regulation. So the kidneys also help to regulate the blood pressure, electrolyte balance, and also red blood cell production. So now that we have looked at what UTIs are, the urinary tract, and also its functions, now let us look at who are more likely to be infected with the UTIs. My first point is that women are more likely to get UTIs than the men because of their anatomy. So women have a shorter urethra than the men, meaning that the bacteria has a short distance for it to travel and reach the bladder easily. So even if I'm saying that the men are less likely to get the UTIs, for them when they do, it's often serious, and it is linked to even other serious conditions like the prostate problems. Second point is people who are sexually active. Now, I'm not saying that people should stop having sex. No, if you're having sexual intercourse, let me use this. This is your anal area, your anus, and this is where your vagina is. And let me say you're having sex with your partner. If their penis is from here, from the anal area, and then it goes into your vagina, it comes from your vagina, goes to the anal area. If there is this back and forth, it means that the bacteria from the anal area is being taken to the vagina. And if this happens, this person is putting you at a risk of getting a UTI because they are transferring bacteria from your anal area or your genital area to the urethra or to your vagina. So it is going to put you at a risk of getting a UTI. And also, if you're changing sexual partners or you have a new partner each time you're having sex, that would put you at a risk because you do not know where people have been. So that could also be a factor. In relation to that, I can also talk about personal hygiene practices like wiping from the back to the front. For example, if you've gone for a long call in a toilet and you have done that, if you're wiping from the back to the front, I've already said you're going to be transferring the bacteria from the anal area to your urethra, because remember we said that this E. coli is in the digestive system. It is found in the bowel in the digestive system. So that means you're just transferring it from your anal area to your urethra, and this is putting you at risk. So educate yourself and educate also your loved ones. You have to be wiping from the front to the back. Another point is pregnant women normally get UTIs because of the weight of the baby putting pressure onto the urinary tract, causing urinary stasis. Now, urinary stasis is a condition in pregnancy where urine accumulates in the bladder for longer periods than normal. And that is the reason why you will see that UTIs are kind of common in the pregnant women. Also, the suppressed immune system. So people who have conditions like diabetes, these conditions provide a favorable conditions for the bacteria to grow and to multiply. Therefore, also these people are at a risk of getting UTIs. Another point is the general long use of the catheters. So catheters are like flexible tubes that are used to introduce or drain fluids from the body. Now, long use of the catheters normally introduce the bacteria into the bladder, making these people at risk of having UTIs. Now, let's be realistic. People do not have money to change catheters every 2, 3 or 4 weeks. I have seen it. They come, and when you look at the catheter, the urinary bag, when you look at the urinary bag, the tube, the urine is not looking good and the urine is not smelling good. That means they have a urinary tract infection. The cause of this is people do not have money to change these catheters. If the person is changing this catheter, it will be less likely for them to get infected because you keep on monitoring, first of all, as a healthcare provider, and you keep on advising them, but people do not have that. So a person comes back to the hospital maybe after 2 months or 3 months and they already have a UTI. Then it takes me to people who have spinal cord injuries. Normally these people experience incomplete bladder emptying, and these ones are also going to use catheters in a long period of time, putting them at a high risk of getting UTIs. Then in the same line, about catheterization, men will have a prostate enlargement. When your prostate enlarges, it's going to obstruct urine flow. Therefore, in the long run, you're going to have urine retention. First of all, urine is a waste product. It's supposed to be expelled or excreted from the body. The mere fact of it being in the bladder for a long period of time is not good for you. This is putting the man at a risk of getting a UTI. And also, people who have problems with the prostate, your prostate has enlarged. If you've been seeing your urologist and you're finding a solution to this issue, that means you're going to be using a catheter. And if you're using it for a long period of time, that is also going to put you at risk of getting a UTI. People who also hold their urine in when they feel the urge to urinate, you are doing a disservice to yourself. First of all, you are slowly damaging your bladder, but at the same time, remember that urine is a waste product, as I already said. It's supposed to be excreted. So you're also putting yourself at a risk of getting a UTI. Then also low fluid intake, or people who do not take enough fluids. Remember, they encourage you to take these fluids because every time you're taking fluids, you are flushing your urethra, you're flushing your bladder, you're helping it like clean itself up. However, if you're not taking enough fluids, you're just helping the bacteria to multiply. Then lastly, people who have ever had a UTI, if you've previously ever had a UTI, you are at a risk of getting another UTI. Those are called recurrent infections. So educate yourself and find out what is exactly causing these UTIs, or else you're going to continue getting the recurrent infections all the time. When it comes to the signs and symptoms of UTIs, we can talk about dysuria. This is pain when you're urinating. Some people may also experience a burning sensation, and this is because of the irritation of the bladder and the urethra caused by the infected organs. And then there is also the urinary urgency. This is a sudden or a strong need for you to urinate immediately. It is also accompanied by discomfort in the bladder, and also the fear that you may not be able to hold in your urine long enough for you to reach the bathroom. So sometimes when people go to urinate, they will see those small droplets of urine in their knickers or their boxers because of the urgency. Then you also have the frequency, urinating more times than usual. So you find yourself going to the toilet so many times, even when the bladder is empty due to the irritation. Another symptom is the foul smelling urine. So the urine will have that offensive and unpleasant bad smell. And if a UTI is present, the bacteria in the urinary tract will cause the urine to change in its appearance, color, and consistency. And then there is the suprapubic pain. This refers to the discomfort or pain in the lower abdomen, specifically in the area just above the pubic bone. This pain can occur due to the inflammation and irritation of the bladder or the lower urinary tract. Then we go to hematuria. So this refers to the blood in the urine. This is not a typical symptom of a UTI, and it doesn't occur normally in simple UTI or the lower urinary tract. It occurs in severe conditions or when an infection has now ascended to the kidneys or the upper urinary tract. There is also nocturia. So this is when a person tends to urinate a lot at night, disrupting their sleep patterns and requires waking up multiple times during the night. Then lastly, we can talk about urinary hesitation. This is when a person has difficulty starting and maintaining a urine stream. So let us talk about the pyelonephritis. This is a complication of the UTI that affects the kidneys and the renal pelvis. This is part of the kidney where the urine collects before entering the ureters. So this results from the bacterial infection that begins in the lower urinary tract and then ascends to the kidneys. So the patient will experience all the signs and symptoms that I've discussed previously, but on top of that, they will also experience these signs. There is fever accompanied with chills and sweating, flank pain, that is severe pain in the sides of the lower back, just below the ribs, which can radiate towards the abdomen or the groin. Then lastly, nausea and vomiting if the infection is very severe. So here are some of the tips to help you prevent UTIs. Number one is hygiene practices. Make sure that you're having good bathroom hygiene practices. You're wiping from the front to the back. Stay hydrated, have enough fluids, because this is going to help your bladder flush out, clean itself and flush out the bacteria. Also, after sexual intercourse, go to the bathroom, urinate and wash down there with just water. Just water. Avoid irritants like caffeine, stop over smoking, excessive intake of alcohol. That is not good for you. Just generally have a good balanced diet. I always talk about this. Make sure that you're wearing breathable cotton underwear and have good menstrual hygiene. That is, you're changing your pad or your tampon regularly. Then lastly, make sure that you are treating the underlying symptom. What is causing the UTIs or the recurrent UTI infections? If it's the diabetes, make sure that you are having this under control. And if it's the enlarged prostate, make sure that you're seeing your urologist so that you remove the unnecessary use of the catheters. And if you have seen any of the signs and symptoms that we have discussed, make sure that you go and see your healthcare provider for personalized advice. When it comes to treatment, UTIs are normally treated using antibiotics. So on top of the antibiotics, of course, when you go to the hospital and see your healthcare provider, they will look at the signs and symptoms, they will do medical history, and then they will do a urine test or urinalysis. So visiting the hospital will give you proper diagnosis and treatment of the UTIs. The form of antibiotics that is used to treat the bacterial UTI depends on which part of the tract that is involved. So the lower tract UTIs can be treated using oral antibiotics, while the upper tract UTIs normally require IV or intravenous antibiotics. These are drugs that are normally given through your veins. It is important for you to notice and treat a UTI. The earlier the better, because untreated UTIs become more and more severe as they spread. So another thing you have to know is the lower tract UTI are easier to manage than the upper tract UTIs, because with the upper tract UTIs, the bacteria tends to ascend up, affecting the kidneys. And when the kidneys are affected, a complication we discussed previously known as pyelonephritis is going to come about. So this is going to inhibit the functioning of the kidneys. So if the condition continues progressing, then the infection is most likely going to spread into your blood, leading to a life-threatening condition called sepsis. Over-the-counter painkillers like ibuprofen can help you to alleviate like discomfort, for example, pain and fevers. Then another thing, teach yourself to take water. Drinking plenty of water helps to flush out the bacteria from your urinary tract, and it also helps with some symptoms. So teach yourself how to drink water. Then lastly, follow up. After completing your medication, it is important for you to go back to the hospital and do maybe a follow-up urine test or urinalysis to make sure that the infection has been cleared. If you've made it to the end of this video, thank you so much for watching. Do not forget to like and share the video. The more you like and share the video, the more the algorithm will recommend my video to more people. Don't forget to subscribe and hit that notification bell so that you don't miss out on any of the videos that I post. I'll see you in the next discussion.